Hi, I'm Bob Smithing. I'm a family nurse practitioner since 1981. I practice at Family Care of Kent, a nurse managed center in Kent, Washington. We've been open since 1985. I practice with three other nurse practitioners, and I've been using Isabel for about a year now. I've got an iPad that I use clinically, and I use Isabel. I've taken Isabel in the room, sat there, had my patients give me their symptoms, asked follow-up questions, and put them in and used it to generate a differential diagnosis that I could then discuss with my patient and do more questions to narrow it down. Patients react very favorably. What I do in my patient flow is I say, look, I need some help here. I'm going to bring in Isabel, and they look at me like, who is Isabel? And I explain who Isabel is, and then they say, okay. And normally I'll bring them back for a different encounter, do it on a different day, so that I've got a slot where I can spend the time getting all of the symptoms, because these are usually medically complex patients that have a multitude of symptoms. And I will feed it into the computer and then run it while I'm sitting there. The patients love it. They think that the addition of technology is a great idea, and I've never had anybody say, oh, I don't want to do that. But they do like the fact that I'm trying something different and that I'm using computers to help increase my knowledge level and to get to a differential diagnosis, because many of these patients have been to other providers and they're just not finding an answer, and they're frustrated and people aren't taking them seriously, and some of them have been told, well, it's all in your head, it's not real. And it's not always all in your head. Isabel recently added a symptom checker that can be used directly by consumers. And I think this is a wonderful idea. I'm going to take some of my patients who have some challenging symptoms. I'm going to tell them about it, send them out there, and I'm going to see what happens with it. I think that putting that tool in the hands of consumers is going to, especially a tool that is thoughtful and give you back a list of diagnoses that is refined, will be beneficial in our patient interactions. So I think that the consumer version is a great idea, and certainly a better list than they will get from their friends. The benefits are you're helping your patients. The benefits are that it may shorten how long it takes to reach a differential diagnosis that's a challenging one, that's more of a zebra one. And your patients will like the fact that you're more high-tech and you're using computers to help them get the care that they need.